need no introduction. So he's a mentor and a seafood to I think most of us here, or even all the urologists in Malaysia. So Dr. Clarence Lay is now a consultant urologist in the Norma Medical Center. So we got one very long list of CV here. Too small for me to read now, just need reading glasses. Huh? So he is also the past president of Malaysia Urological Association. He has much experience in almost all topics. I always enjoy his talk because he will share his personal experience into it, right? I'm sure he will show you. He will share with you about polyuria, harms in it, elderly and contemporary management. So you have the personal one.
Thank you. I want to say good afternoon to all of you, also to the I think almost 300 people who are still logging online, although this is almost the last lecture of the day. The topic given to me by Aaron is nocturnal polyuria, and specifically on harms to the elderly and contemporary management. So it's a very specific topic. So I want to thank you for giving me this topic. He has read my mind. This is my passion. I really enjoy talking about this topic of nocturia. I received no sponsorship for speaking today. This is my opinion. So you also have to take personal responsibility for my conclusions. So the first of all is the definition. Let me see if I can remove the timer. Mr. Day said, I can't see my slide if the timer is there. Now he's thinking already. Give me technically also. So the definition of nocturia is passing urine once at night. And I want to emphasize that there was a previous lecture given by another speaker this afternoon who gave you a different definition. So if you want to win the prize, this is one of the MCQ questions. So please Google it before you answer. See who gave you the right answer. Okay. It's obvious which speaker give you the right answer. Huh? So nocturia is defined as one time a night, once, not twice, not once. And the polyuria is 1/3 of your output. Usually people sleep 8 hours, so 1/3. But in younger people, they allow for less, 600 cc's. In my view, even if you have no polyuria, I think they still require treatment. I think that's the semantics. Some people say, oh, if you don't have polyuria, you don't need to be treated. I think so long as you have nocturia that bothers the quality of life, I think it still requires treatment, even if you produce less than the defined quantity of urine. The second definition problem is definition of elderly. No, not good word, right? Elderly. So I'm 66, so am I elderly? Do I look elderly? I don't know. Okay, so I think the age is not a very important factor, but it is only important in as far as slides not moving anymore. It's misty there. You don't need the
use the keyboard. Use the keyboard.
So the next slide is on the. Still answer to come up, huh? So the definition is that you have to pass urine and go back to sleep. So it's nocturia is voiding, preceded, and followed by sleep. So you wake up in the morning and you pass urine and you go about doing your business, whatever that business is, then it's no longer that episode is not considered as nocturia. So that's also important in your MCQs. Huh? The third definition is that when you wake up in the morning to pass urine, that volume is calculated into the polyuria. Okay, although the episode is not counted, but the volume is included. So that's the definition. The next thing is, what are the it's the finger. Not the place you press, it's the finger. Misty. I'm saying Dr. Yong.
Richie can answer your first answer. Q&A. Huh? You type there. You type the answer and then just send. You can see for everybody or for everybody.
I think I use the cursor.
I think you got two questions. The CBD you went to win.
The cursor will run. Press hard. Harder better. This one is the fast lecture, right? Okay, thank you. So how do we know how often is nocturia? Every time I give a lecture, I must show this study. This is a landmark study by Dr. Clarence. And it shows that 56% of people coming to our prostate awareness week have got nocturia. This is one of the very early pictures, very early pictures. Some of you may be, maybe Hamka is there. I think Hamka is here. Anybody else here? All the rest gone to Saudi Arabia or somewhere else. But we're still here. We're still here. Okay, so actually it's a very, very common symptom, and actually it's also common in patients who have BPH or LUTS. Okay, and of these, many of these patients, 13% of these patients actually do not have enough sleep. So this actually is a very serious problem. So all of us are healthcare professionals in this room, right? So you will be facing people with this problem. Okay, I think this is a different technique. Okay, I use this one.
They can see also. The Zoom also can see the cursor.
What about in Asia? Many years ago, we did a study in Asian study, and again, nocturia is 64%. 64%. Okay, so it's a very common symptom. In UKM, they also did a study. They published it, and they find that 85.9% of the patients, when they study patients with BPH, have got nocturia. And you look at the men, the incidence of nocturia is, okay, I confess my age, 60 over years old. So there's 60% chance that I have nocturia, more than 60% chance. So I can talk to you from personal experience. Since that's what the call has already alluded to. Women also have a lot of nocturia. In fact, they got more nocturia than men, and they do not have a prostate. Okay, so, and many of you are in this audience, probably I think 30s or 30 to 40s. So many of you do have nocturia as well. Okay, so this is a topic which is important to you personally and to your family members. Okay, now, and then these people with nocturia, this is a European study. These people have got nocturnal polyuria. So in some communities, many patients not only have nocturia, they also have nocturnal polyuria. Okay, nocturnal polyuria. Of course, the treatment is a bit different. I come to the treatment later on. And it does affect the quality of life. Okay, if you have nocturia, it doesn't affect the quality of life, so what? But the fact is, it does affect the quality of life. What are the parameters in the quality of life that is affected? Okay, can use the cursor better. Most important, of course, is falling down. Falls. You wake up at night to pass urine, then you fall down. You have fractured hip. If you fracture the hip at the age of 70, the chance of you dying is 50%, very high. Okay, and also it affects your lifespan. So people who have got nocturia have a shorter lifespan, and also affects your productivity, of course. So all these are studies. They actually, to me, is intuitive that you have nocturia and don't sleep well. When you wake up in the morning, you're not fresh. You cannot do your work well. But this is studies to prove that it does affect your productivity. This is a study done in Denmark, and another study done in Finland shows that it affects the quality of life, and all these are published data. And this is the important study that says that if you pass urine a lot at night, you are at an increased chance of dying. If you pass urine more than twice a night, it's associated with increased mortality in the elderly, even adjusted for all the other factors. So people like to show these guidelines, flow charts. So this is the official flow chart on how you manage nocturia. And it centers along the lines of urine production. I personally don't like flow charts very much. I prefer to put in my homemade charts. Homemade is produced by Clarence. So basically, if you're a patient with nocturia, you have to consider that it may be many factors behind it, not just the pure polyuric nocturia. You may have problems with your bladder, and now we know bladder can be underactive. Just now we talked about overactive bladder, but it can also be underactive. or the bladder may be okay, but not working well with the rest of the body. There's dyssynergia. There may be cancer, there may be infection, there may be uterine stricture, which Dr. Dave mentioned earlier. There may be problems in that region, stone in the lower ureter, females with cervical problem, cancer in the colorectal area, and also don't forget the kidney as well. So a lot of patients in Malaysia, in Kuching, have diabetes. They've got a blood sugar of 20, and they come and see me and say, oh, I got nocturia, can you stop it? I pass every 10 times a night. But if the blood sugar is 20, I think you have to treat the blood sugar first. And of course, you will think of it as a neurological condition, hormonal production, your sleep, your mental health, all this comes in together. So this is my sort of diagram to explain to the patient. But another way to look at it, of course, is to do a chart. Okay, so nocturia, the topic I'm assigned is nocturnal polyuria. But actually, this has to be considered in the context of all these other factors. Okay, overactivity we mentioned, heart disease we didn't mention today. Psychology, I think, is always there. And then the elderly patient, diabetes mellitus, diabetes insipidus, not so common, but I have one patient who has got diabetes insipidus, producing a lot of urine day and night. So the treatment, of course, is different. And of course, as you grow older, there's some problems with the bladder. I think this thing is shaking, Mr. Lee. There's a vibrator inside. Okay, what about investigations? You have to do basic, in addition to the proper history, including bladder diary, you have to examine your patient. And of course, as urologists, we always do a digital rectal examination. And the basic investigation you must do for every patient is a urine dipstick, blood sugar, check the blood, and usually most urologists add on an ultrasound. Okay, so what is the objective of treatment of nocturia? Okay, this is my guideline. Okay, first of all, I think the most important thing is every human being should have at least 5 hours of continuous sleep for good rest. 5 hours. And urination actually is good. I think you should not aim to stop a person from passing urine. Urination is good because if you are dehydrated, you don't drink, then it's bad for health. And if you have a lot of dehydration, then you get postural hypertension. You're taking multiple medications from people, then this will affect also your general health. So I think so long as you can sleep 5 hours a night, you arrange your treatment in such a way that the patient or the person can sleep 5 hours a night, I think that is sufficient. We cannot stop urination. So this is multifactorial, but this is like quite transparent and multifactorial, different from sex. So you have to involve the family and the doctor, not just the doctor. Okay, and intervention should not be just by talking about medications. I don't think there's an injection or pill that can treat illnesses. It is more than just that. So lifestyle modification is important. For example, if you're traveling, you upgrade to an housing or upgrade to business class. And exercises, diet, bladder care, very important. The idea is actually you should try to avoid taking drugs for most diseases. And of course, cost is very important. We spend a lot of time, I know we are sponsored by a lot of companies. These drugs are very, very expensive. And long-term treatment, in terms of cost, long-term use of drugs, we actually don't know the long-term side effects of many drugs. So I am one person who is now very for lifestyle adjustment, bladder care, exercises, and dietary intervention for this disease, especially for nocturia. Okay, now this is the scientific evidence for 5 hours of continuous sleep. I'm talking about continuous sleep, not sleep 5 hours a night. So you go to sleep at 12, you wake up at 1, wake up at 3, wake up at 6, you sleep until 10 o'clock. Of course, you accumulate more than 5 hours, but that is not sufficient because it's the first 5 hours that allows your brain to rest. And if you wear something like this, they can actually monitor your sleep. The first part of the sleep is the most important. The first part of the sleep. So the first time you get out of the pass during the night, that is what we aim for, 5 hours. Patients often like you to give them some treatment, give them an injection or do some operation, admit them to the hospital, use their insurance or whatever, to do something with them so they are cured. They want something like this. But in actual fact, many of the diseases that we have cannot be treated. Okay, so lifestyle is very important. So if you have a patient, and I can tell you I have many patients who are compulsive drinkers, they keep a bottle of water next to their bed. They wake up, pass urine, they drink 1 glass. Go to the toilet, okay? Sleep, wake up again. So if they are compulsive drinkers, they cannot be treated. You just have to tell them you want to drink, you pass urine. But I cannot give you a medication to stop your urination. I mean, we can give them all the hormones, so that their whole body gets swollen, they get hyponatremia. But if they are compulsive drinkers, if they belong to this group of patients, is a primary polydipsia. These patients cannot be treated by medications. They have to adapt to the lifestyle. If they must drink, I encourage them to take special tea infusions, which can be used at night. And I've spoken to the pharmacologist of this company, and they said this medication, this actually not medication, it's called an immunomodulating effect. Somehow it affects the immune system to allow you to slow down the immune system so you can sleep. So if they have to drink at night, I ask them to take a mouthful of drink. The next thing is, of course, to boost your own body resistance, your own immunity, your own hormonal production. So if you go for a walk in the evening, in sunlight, I'm not sure about pelvic floor I'm not sure about pelvic floor. But if you just go for a walk in the evening and you reduce the fluid accumulation and you sleep well, then that will actually reduce the nocturia. So you think that I may be talking crap? No. Actually, there's a study done in Korea. 70,000 men. They follow up for 2.6 years. And I can tell you there are many studies coming from Korea, Taiwan, China. And this actually shows that if you have physical activity, including walking, especially walking, it will reduce the urinary symptoms, including nocturia. So what are the lifestyle things in addition to just walking? Okay, so this model here is myself. You can take pictures from the internet nowadays, and they will come back to you asking for money. Okay, so what are the lifestyle things you can do? You want to reduce the amount of fluid in the body at night. So in the afternoon, if you lift your leg up, you rest for 2 hours, all the fluid in the leg will go back and you can pass it out. I know Mr. Tay like to give them diuretic. Or you take this diuretic at 4 o'clock, you pee out the urine, you can carry on operating, doing your robotic surgery, and then you won't have nocturia. So that's another way. But I don't like to use them diuretic because it may affect the electrolyte balance. Now the thing so and you can also wear stockings. Stockings for those nurses who work in the afternoon, you can wear stockings. You can sit down, elevate your legs so that the fluid will not collect there. So a lot of the nocturia in elderly people is because of the fluid collecting in the lower limbs. When they go to sleep at night, they pass this out as urine. They get nocturia and nocturnal polyuria. They are not actually really in frank heart failure. Okay, not in frank heart failure. So these are the lifestyle strategies. Another thing which Dr. Vijay alluded to earlier when we talk about OAB is bladder care. I don't like to use the word toilet care, bladder care. This bladder care, I give credit to my daughter. She works in London, so she sees a lot of old people with all this polyuria, nocturia frequency. So she said, you tell the patient to take care of the bladder because the bladder also getting old in age, and so the bladder got less feeling. So they must have time voiding. So if my bladder is full, sometimes I don't feel it, but when I get into the aeroplane or get into the bus, certainly I feel I'm fast feeling. So that's the thing of time voiding 2 to 3 hourly. And as we grow older, the bladder also undergo fibrosis. And we also got a lot of other problems like diabetes, hypertension, stroke, dementia. So you must improve your bladder emptying by doing time voiding and double voiding. Okay, so that is quite important to look after the bladder. So night time before you sleep, you empty the bladder well, and empty the bladder twice. And don't drink so much fluid 4 hours before sleep. In the afternoon, take an afternoon nap. And of course, it's not just the water, it's also the makanan. The food we take. This is the diet my daughter prescribed for me. Don't take salt. Take vegetable, fruits, no carbohydrate at night. So reduce all this, so that this will actually reduce your nocturia. And if you have to go out in the afternoon to see a movie, to see the latest Kila movie, whatever, don't drink fluid before you go inside. You go and buy 1 jug of root beer and take chips. Of course, halfway through the movie, older people, elderly people like me, we have to go and pass urine. Okay, so and you sit inside in the middle, all the young girls will kick you because you're disturbing the movie. So you make lifestyle changes. Now we talk about medication. People like to take medication. So it's elderly men having nocturia, maybe difficulty passing urine. I don't know. I don't have a machine to do the flow rate. Give them an alpha blocker. So this is the effect of alpha blocker on nocturia. It does reduce it a little bit if the nocturia is due to inadequate bladder emptying, if there is any bladder obstruction. What about doing a TRP? Oh, do a TRP like this. You got nocturia. Go and do a TRP. Then they will solve his nocturia. So that is the big mistake. It's a big mistake because TRP by itself will not reduce the nocturia very much. It does reduce it, but not very much. It does help to empty the bladder better, you know. So surgery and treatment for BPH may not guarantee a cure for nocturia, unlike what most patients think. Yeah, I'm going to touch on this anticholinergic problem. So some people say, okay, I pass urine a lot at night. Maybe I take an anticholinergic, whatever, like mirabackground or Vesicare or whatever. They will reduce the bladder contraction. It will relax the bladder. Mirabackground relax the bladder. So I should empty the bladder less. But that is only if the nocturia is due to an overactive bladder. If the patient has got no daytime frequency, no urgency, in the daytime he's okay, he see movie 4 hours, but nighttime he go to sleep, he passes urine 6-7 times. So those patients will not respond to an anticholinergic or beta-3 agonist medication. Okay, so you have to choose the patients well. Some of them may respond. You ask for my personal experience, right? So I can tell you, I take one anticholinergic at night, take one alpha blocker at night to reduce my nocturia. Okay, so sometimes that doesn't help. The other problem that is that of sleep apnea. I think sleep apnea is a lot commoner than we think. It is in 1 in 4 Australians. I was giving this lecture in Kuala Lumpur one day, and my colleague told me, Clarence, you forget about to mention about obstructive sleep apnea. So if you have obstructive sleep apnea, if you treat it with, for example, a CPAP, you'll find that your life is completely different. You sleep better, and you have less of nocturia. Okay, the rest are made home cooked, homemade by me. How to improve. These are all pictures taken from my house, except this picture. Except this picture. so this is myself. This is not from my house. This is from the internet. Okay. So to keep your feet warm, you adjust your aircon and try to give up the noise. One of the big problems in the modern era is there's too much light in the house. The television, the handphone, the iPad. So you must keep up all this light because when the eyes see light, the brain produces a different hormone. They do not produce desmopressin. So you tend to pass urine. You cannot go to sleep well. So you have to wear an iPad. And of course, I think most of the bedroom nowadays, we have got this monitor, this security monitor, monitoring the whole house inside, outside. So be careful with that. And aircon as well. I think after the COVID pandemic, most people realize that it's not good to have aircon. It's better to have natural ventilation. But to ventilate the room, you need windows on both sides, right? Okay, so these are the tips that I can tell you. Many of my patients are very appreciative of giving them this feedback. And of course, as Vijay said, you follow them up every month. Don't say nocturia. Nothing much I can do. I give you this medication. Finish, gone. You have not treated the patient. You ask them to come back and you go through each item with them. Sometimes better still bring in their partner. And the partner say, no, I have to have the aircon to sleep. Then I tell them, in that case, you sleep in a different room. How to prevent falls? Sometimes most people will still have to pass urine 2 or 3 times a night. So don't go to the toilet and pass urine. Pass urine next to your bed. Put the urinal there. Because you go to the toilet, you switch on the light, you open the door, you wake up somebody. And if you go to the toilet, make sure that toilet is sleep-proof. Put a sleep-proof mat there. And again, I tell you, this is from my house, personal experience. Okay, now I talk about this drug. I think this drug is very important because many urologists, many GPs, many geriatricians love to dish up medication to stop urination at night. And that is Minorin. Minorin is the brand name, desmopressin. If you give this medication, there's a peculiar side effect, and that peculiar side effect is low sodium. So you have to check the sodium at day 0, 3, 7, 30. Especially if the patient's got diabetes, got heart failure, and if the pre-treatment sodium is already low, or if they've got some amount of CKD. So all these are risk factors. And according to the leaflet, you cannot give it to people above 65. That means I cannot take it for some reason, some strange reason. I'll tell you later on. So this drug is quite common. And if you give it to these patients, if after 1 week they come back, if you're confused, you check the sodium is 110, don't rush it to give the sodium. Do not replace the sodium urgently, because that will cause a metabolic imbalance and they got CPM, then they get paralyzed, permanently paralyzed. So that is Minorin that's available in the Ministry of Health. This is available in the Ministry of Health. It's given to children for PNE. It's given to the endocrine clinic. This is not available in the Ministry of Health. This is the sublingual version. This is I think 0.60 micrograms, but this is still too high dosage. So there's a new formulation. It's available in Singapore, but not in Malaysia. It's called Nocturia. It's 25 to 50 micrograms. So there is actually quite a lot of things which you can use. To me, this is the last line, but to a lot of European countries, this is the first line. You go to the Ferring website, it's there, and they are very active. They have a lot of talks all the time. Finally, if you have so much nocturia, you cannot stand it anymore, like my good friend Christopher Chen, he put a catheter, put the intravenous catheter. I shared this book with BUU, you know. I shared this book with you. So we passed the exam, FRCS on the same day, and he wrote a book. And in the book, he said, we have to pee so much at night that he actually put a catheter. But he's a urologist. He's a very good urologist. This is the book he wrote. And he didn't realize that actually putting a catheter is no joke. There's so many things you cannot do. You even try to go swimming with the catheter. So if you don't put a urethral catheter, you can put a suprapubic catheter like what Dr. Dave told you about suprapubic catheter. Dr. Dave will tell you there's a risk of injury to nearby organs, and of course risk of bleeding. So the last thing is that if you go to the old folks home, if you're looking after old folks in the hospice or people with terminal cancer, maybe the final solution is to put a suprapubic catheter. So this is almost my last slide. So this is my take-home message. So nocturia is a very common symptom. It affects your sleep, it affects your quality of life. Nocturnal polyuria is a separate subset, but to me, even if you don't have polyuria, it still requires treatment. Lifestyle, most importantly, is walking, dietary therapy, lifestyle changes to adjust the fluid in your body, take care of your bladder, treat all the medical conditions. Sometimes as urologists, we forget that the diabetes, the coronary disease, the stroke, the dyslipidemia, we have forgotten to treat them. Although some urologists try to do men's health, but I think sometimes we don't look into it as well. So medications, very limited role, alpha blockers, mirabagrone, I think probably anticholinergics, not good in the older group of infections. Older group are not elderly, older group, and maybe medications in the select group of patients. So thank you very much, and that is my email and my WhatsApp.